Hi everyone, Dr. Chitra here, and Study MRCOG is back once again to help you in your preparations for Part 3 exams. We bring to you a series of stations to help you clear this exam, and this time we are calling it as the Exam Ready series. So today we are going to be seeing a station on maternal medicine. It's a simulated patient task. Okay. And as you know, in the exam, you would be getting 2 minutes of reading time, then 10 minutes to do the task. And then in the exam, you would not be getting a feedback. But today we have a surprise examiner with us. She's going to be giving me a feedback after the station is done. So we will be knowing about the salient points, the points that are to be covered. All right. So let us start. These are the candidate instructions. You would get 2 minutes in the exam to read this. Please give it your whole attention. Read very carefully what type of task it is, what all is given in the candidate instructions, and what you are supposed to be doing in the task. And also see the domains that you are going to be assessed on. Okay, so I'm not going to take 2 minutes because I already know what is there. I think let us begin. Yes, Vaishnavi, you can switch on your camera. And Dr. Soumya, it gives me the feeling that I'm back for my exam now.
You'll be fantastic, don't worry.
Okay, before I forget, this is the letters from the GP. So there are two pages that you have in this. Normally, maternal medicine, you would be having a lot of pages. So please go through everything very carefully. So let us begin. Like I would be going inside in the cubicle once the bell rings. And I would start off by, hi, am I talking to Miss Shelley?
Yeah.
This is Dr. Chitra, your one of the doctors in the clinic today.
Hello, doctor.
Yeah. How can I call you?
You can call me Miss Shelley.
Right.
Sorry.
So Shelley, I gather from your GP letter that you have a condition called multiple sclerosis, and you have some concerns about starting a family. Is that
Yeah.
right?
Yes,
All
doctor.
right.
I'm suffering
Yes.
from multiple sclerosis since past 2 years and planning to conceive, but I have few concerns regarding this condition, like how will it affect my future pregnancy and what are the adverse effects on the baby?
All right. So, Shelley, it's really nice. I appreciate the fact that you are so much concerned about your baby and you are here to discuss those concerns. But before that, tell me, how are you coping up with the condition in general?
In general, I'm fine. I'm doing it well.
All right. Thank you so much. Good to hear that. And can you tell me a little bit more about how the condition started, what medicines you are on?
It has started with weakness, generalized weakness, and progress with progressive symptoms of weakness. I don't have any other symptoms, and currently I'm on mycophenol at mofetil medicine.
All right. All right. So, Shelley, can you tell me when the condition started? Did you have any concerns with your eyes, like any problems with vision,
No, doctor.
any body ache or joint pain?
I had body ache and joint pains.
All
It
right. And
initially it was generalized weakness. It has been progressed to joint pains.
all right. What about your waterworks?
I work as a teacher.
No, did you have any problem with passing urine when you were like diagnosed with the condition?
No,
Okay. Any other symptoms that you had when you were diagnosed?
no,
All
no other
right.
symptoms.
And yeah, from what I gathered from you, after the medicine has been started, you are doing fine. So right now you have no concerns.
Yes.
All right. Okay, so before we move ahead and I tell you how you are going to be coping up with this during your pregnancy, is it okay if I ask you a few questions so that I get to know a little bit more about you?
Yes.
Okay. Are you generally fit and fine?
Yes. Generally, I'm fit and fine.
All right. Anything in your family that I should be knowing of?
No, there is no
Okay.
significant family history.
Mm-hmm. A few personal questions like, do you consume alcohol?
Yes, occasionally I consume alcohol when I am with my family members.
All right. What about smoking?
I do smoking, about 4 to 5 cigarettes every day.
Right. So, Shelly, as you know, smoking in general would adversely affect your general health. And
Yes.
when you are pregnant, it would also affect the baby. And especially, it has been seen that anyone suffering with your symptom like multiple sclerosis, it is known to aggravate the condition.
Yes.
So, it would be advisable if you would try to quit smoking. What do you think of that?
Yes, doctor. I will try to quit the smoking.
Okay, fantastic. So I would put you in touch with the NHS quit smoking services, and they would help you to, quit smoking.
Okay, doctor. Thank you.
What about drug use? Any drugs for fun?
No.
Okay. About your body weight to height ratio, any idea how much it is?
My BMI is 24.
Okay. About any allergies, food or drug, anything?
No, I don't have any allergy from food or any other drugs.
All right. Shelly, what do you do for a living?
I'm a teacher by profession.
Okay. And whom do you stay with?
I stay with my partner.
How's everything at home?
Everything is fine at home.
All right. Thank you so much, Shelly, for letting me know all this. So I gather that you have a condition called multiple sclerosis. You are on a drug called mycophenolate mofetil, but at present you are doing fine with the drug. Okay.
Yes.
Okay. So now moving ahead, any concerns that you have in particular that I should be addressing?
I have concern regarding planning my pregnancy.
All right.
Is it right time to plan the pregnancy?
Okay. So before we move ahead, can I know when did you visit your brain doctor? Uh,
4 to 5 months
like how
back.
many months ago? All right, all right. So before you plan a pregnancy, Shelly, I would like to put you on folic acid. Okay.
Okay.
And I would also like to make an appointment with your brain doctor at the earliest, since the drug you are on right now, mycophenolate mofetil, it's not something that is very safe in pregnancy. So the doctor would be changing you to a drug that is more safe in pregnancy.
Okay,
Okay.
doctor. Yes.
Until then, you should be using some reliable form of contraception.
Okay.
Am I clear till now?
Yes, doctor.
Okay. So now coming to the pregnancy, let me reassure you that multiple sclerosis is not a condition that is generally passed on to your baby. Like it is not something that goes down in generations. It is more of a disease that is affected by environmental factors and all those things. So your baby is not very likely to get the condition.
Okay.
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 And there is a very minimal risk of having a miscarriage or having a baby with some form of anomalies due to the condition.
Okay.
Okay. So once you embark on your pregnancy would be a high risk pregnancy. So you would be looked after by a team of doctors consisting of my consultant, your brain doctor, the baby doctor, a nurse specialist, a midwife. Your GP would also be in the loop. And then we would be including a doctor called as the pain doctor to help you make your labor more easy. Okay.
Okay. Okay.
Okay. So for the baby, as for the baby is concerned, there is a few chances that your baby might not be growing very well. So we would be asking you to, have extra growth scans for the baby.
Okay, doctor.
And during the pregnancy, it is usually seen that women, those who have multiple sclerosis, they do fine in pregnancy. Sometimes some of your symptoms might come back. Okay.
Okay.
So to overcome that, what we advise you is to have a healthy lifestyle, to keep yourself well hydrated, take as much rest as possible, continue with your medicines and have your checkups with the brain doctor.
Okay.
Okay?
Fine, doctor.
Am I clear till now? Yeah.
Yes, yes.
So, yeah, we would make sure that you are followed up very well in your antenatal care. And then regarding your delivery, okay, so you would deliver in a hospital in a consultant-led unit where all facilities would be there to help you and your baby.
Okay.
Okay. And we would try to give you a normal birth as far as possible, a cesarean section only if there are some concerns for you or for your baby.
Okay.
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 Then in the postpartum period, it has been seen that breastfeeding is really beneficial for women, those who have multiple sclerosis. So we would encourage you to breastfeed your child as far as possible.
Okay, doctor.
Okay. And if in case you have any concerns, the brain doctor would always be there to help you in case your symptoms return back. So he would be adjusting your medicines or changing your medicines to some new medicines.
Okay.
Is that okay?
Okay.
And also, we would advise you on contraception so that you do not have any other unplanned pregnancy.
Okay, doctor.
Any other concerns that you would like me to answer?
No, doctor. All of my concerns have been addressed. So I'm
All right.
feeling satisfied now.
Okay. So I'm giving you a few patient information leaflets. Please go through the patient information leaflets. Here are a few contact numbers in case you have any doubts. And I would be making an appointment with your brain doctor as soon as possible.
Okay, doctor.
Okay. Is that fine with you?
Yes, yes.
Okay.
Okay.
So thank you, Shelly, so much. And
Thank you, doctor.
yeah, thank you
Thank you
so
so much.
much. And take care and bye bye. Yeah.
Yes. Bye bye.
Exact 10 minutes.
Oh, bye. Okay.
Okay. Yeah, Vaishnavi, if you have got any feedback for Chitra, for as a doctor, do you want to see her again or whatever? So you can go on. If at all, if you have any feedback for her.
Feedback. Oh, she's excellent teacher.
That's a different
No,
story.
as a doctor.
Now she's a doctor here, so you're supposed to be telling her whether she is a whether you want to see her as a doctor.
Yes, yes.
Okay, fine. Thank you, Vaishnavi, for your time. So thank you so much. So it's always good to see new faces. Thank you for your time.
Okay. Thank you.
Yes.
Thank you so
Thank
much, Dr.
you.
Sonia. Thank
Thank
you.
you. Chitra, only one thing I would ask you, that thing is bothering me, but I'll ask you later on. Of course, as
Okay.
usual, it went on really well. The intro part was there, agenda was there. It was quite smooth. I was wondering whether you would be able to finish the station, but I think you were bang on with the information gathering. I think it was there at 5 minutes or something. Later on, you wound
Okay.
it up so well because smoking you addressed then and there. Then you actually summarize signposted before moving to the next one in a nutshell. And when you came to the management, then you spoke about MDT. I was worried whether you'll miss on mycophenolate mofetil, but you mentioned that the safer medication, probably a little bit push on that this cannot be given. Probably this is teratogenic is something which I wanted to hear from. And I think the relapse you mentioned, postpartum to certain extent breastfeeding, probably a bit about contraception also because it's a metal medicine case. Only thing which I didn't hear is, did you ask LMP?
No, I do not. I do not. Yeah.
Okay, so that was bothering me from that time
That was, yeah,
because
even
what
I
if she's
realized that
already
later on.
pregnant?
Yeah, I realized that later on. Yeah. And one more thing I wanted like about like everyone is very much worried about pap smears and blood group and so is it really very relevant in these kind of
No, unless
stations?
they are
You have to ask them.
immunocompromised. See, pap smears you would only ask in case of APH, preterm labors, renal transplants, HIVs. Otherwise, general pap smear is not really required. The
Not
only
needed.
thing
Yeah.
which is always required is allergies and to greater extent mental health. Rest of the things you can even actually leave it. Like even smoking, of course, you can ask, but you cannot miss in cases like ectopic pregnancies where it really
Yeah.
matters. So those are the
Right.
things which they have to be doing. But pap smear is not required everywhere. It is not.
That's what I was
Otherwise,
worried.
I think well done. So LMP, I thought probably I didn't hear. Probably that is a very important
No,
point.
no, no.
Okay, so,
LMP, yeah, I realized it later on that I should have asked what type of contraception also she is on.
but it's
That's
okay. If you
why,
remember, you could peek in and say that, okay, sorry, I forgot to ask when was your
yeah.
period. That's all.
Hmm.
That was fantastic. Well done.
But
You have covered most of the
yeah,
aspects. Okay,
yeah.
yes. Please.
Okay, yeah. Thank you so much. Thank you so much.
Thank you.
So yeah, thank you. So that's it, guys, about the station. Now let us see about like the most important points, what we would be seeing in information gathering and like all the domains. So in information gathering, it's very important to evaluate what is the patient's current health status, like including about her multiple sclerosis, her symptoms, the relapses, mobility limitations, and functional impact. Okay. Then you need to ask a detailed medical history because like we saw, most of the medications of multiple sclerosis, they are not baby friendly or they are not compatible with the pregnancy. So you should be asking about the drugs that she is on, and then you want to change the drugs. Okay. When was the last time that she met with her neurophysician or neurologist? And make sure that she has had a recent consultation in the last 6 months. Um, you have to address about her concerns about her inheritance. Make sure that you tell her that it is not a condition that is genetically transmitted from the mother to the baby. Uh, Lifestyle modifications, yes, because you need to know about smoking. We know that smoking is associated with aggravating the symptoms of multiple sclerosis, then alcohol use, diet, activity, and you have to tell about the necessary modifications. You could also ask about the past pregnancies, miscarriage, fertility. But in 10 minutes, I think it's too much to ask. But please don't forget to ask about the last menstrual period and the contraception that she is on. Okay. Mental well being, very important. Any anxiety disorder or mood disorders, and the support at home. Now, communication, yes, it should be very patient friendly. You have to explain about MS and pregnancy, how symptoms fluctuate, the risk of postpartum relapse, then the misconceptions that are there, that it can be inherited by the baby. So you have to make it very clear to her that direct risk is low unless both the parents have multiple sclerosis. Then potential pregnancy complications like the symptoms could come back. So fatigue, bladder dysfunction, mobility issues, temperature sensitivity. Make sure that whatever decisions you are making, they are shared decisions. Um, Ask the role player to express her concerns. She can ask any questions that you have left unanswered, and the role player should be actively participating in the consultation. So treatment modifications also have to be untold in an understandable manner. Don't tell her that you will stop mycophenolate mofetil, because then the role player, she will get scared that I'm doing so well with this drug, and if you stop this drug, I will get my symptoms back. So tell her that the drug will not be stopped. It will be stopped, but she will be put on some other drug which is more baby friendly. Okay. And last, don't forget to give written information. Okay. And also give her emotional support, and acknowledge that the patient is excited to start her family. Now, coming to patient safety, allergy is one of the things that you can never forget in any station. Remember that mycophenolate mofetil is a teratogenic drug. Immediately, once it has to be stopped in the preconceptional period. Washout period is about 6 weeks, and till the washout period is complete, you will offer her some reliable contraception. Refer her back again to the neurologist for medication review. Folic acid, you have to start 3 months prior. Then discuss about postpartum relapse. Multidisciplinary team involvement has to be there. Then you will prevent infections. And also you would recommend about regular mobility fatigue assessments. Okay. In applied clinical knowledge, you will tell her that multiple sclerosis does not affect fertility. Certain medications can impact conception and pregnancy safety. Um, Symptom patterns, they usually improve in the second and third trimesters. Increased risk of relapses there in the postpartum period. Uh, Safe treatment options, if you have time, you can talk about the drugs that are safe in pregnancy, like steroids could be safe in pregnancy. About the mode of birth, vaginal delivery is generally preferred unless obstetric indications for doing a CS. All forms of regional anesthesia would be available. All forms of anesthesia like pethidine, gas, spinal, epidural, everything can be offered for relief of labor pain. Then postpartum, they can start the drugs again. And breastfeeding is something that it is seen that it is generally encouraged because it is associated with less relapse. Women, those who breastfeed, they have fewer relapses. Now, asterisk points in information gathering, make sure that you identify the drugs. So mycophenolate mofetil is one drug that has to be stopped before conception. If you do not get this in the information gathering, you are going to lose points. Then communication with patients. So explaining that it does not impact fertility, requires careful medical management during pregnancy. Patient safety, that early neurological referral and medication adjustment, and in the applied clinical knowledge, you have to educate the patient on postpartum relapse risk, emphasize the need for close follow-up, and early disease-modifying therapy restart if indicated. Now, a pass or a competent candidate. This is a candidate that is safe, structured, and patient-centered consultation has taken place. The candidate demonstrates clear understanding of multiple sclerosis, addresses concerns, ensures there is multidisciplinary team involvement, and provides a well-planned management strategy. A candidate that is borderline or partially competent will display some competence, but there are gaps in history taking, communication, safety, or knowledge, and may miss key details or provide partial explanations. So this candidate requires improvement in structure and depth. So like everything is covered, but does not address the issues with smoking, or does not talk about relapse in postpartum. Okay. A candidate that is unsafe, or the candidate that has not cleared the station, unsafe or incomplete management, misses critical safety steps, provides incorrect or harmful advice, and fails to reassure or educate the patient properly. So this is one who lacks essential clinical knowledge. So that was all about multiple sclerosis. I know things are going to get a little bit overwhelmed when you are doing your part 3, but don't worry. Practice, practice, and practice, and you are definitely going to crack this exam. Thank you so much for watching the video. I hope it was useful to all of you. Many, many thanks to Dr. Samya and Dr. Vaishnavi for joining. And good luck to all of you out there. And I'm sure that all of you are going to crack this exam. Bye-bye and take care.